Public health officials in Texas are trying to boost measles vaccine coverage as an outbreak spreads in the U.S. But the country's health secretary has been less supportive of making vaccines the frontline response.
Rolling up their sleeves to stop the spread. Texas locals have been coming to this vaccine clinic as measles cases rise in their state.
With my kids being, immune compromised, and obviously they're not babies, so I didn't do it when they were small. I just had a really hard time giving that many immunizations to my babies, but now that they're older, I feel like we're better off and more equipped.
Hey!
Lubbock City says infants should get their first MMR vaccine sooner in response to the outbreak. Texas has reported hundreds of confirmed measles cases in the state since late January. Dozens of people have needed hospital treatment, and several unvaccinated children have died.
I didn't expect this to be in my own backyard. I knew there was unvaccinated or vulnerable populations in this area, but seeing an outbreak that's this big, that's probably now the largest outbreak Texas has seen in 30 years.
US Health Secretary RFK Jr. talked up the federal response at an event in Indiana. He's changed his public stance on vaccines after advocating against them in the past, but says they're not a silver bullet.
And we can't rely simply on the vaccine. We also have to know how to treat measles. Children shouldn't die of measles. When I was a kid, before the measles vaccine was introduced, there was 500,000 people who got measles, as many as 2 million a year. And nobody got in the newspapers for them.
The US made measles a nationally notifiable disease in 1912, recording the highest measles death rate in the decades to 1940. A drop in cases per capita followed after the vaccine rollout from 1963. But with measles numbers back on the rise, there's concern mortality rates will follow.
We're going to see more individuals needing to be hospitalized, and unfortunately, we are going to, possibly see more deaths. We have amazing technology and resources in our medical system, but they can't always save.
An anxious time for parents near the centre of the outbreak. Loughlin Patrick, ABC News.